Hello, my name is Brooke, and today I'm going to be doing a demonstration of our electronic health record called Quadramed. When you log into Quadramed, the first place you will go is your main desktop, and we know it's the main desktop because of this icon here, Big House, Big Picture. This is our demonstration environment. However, if I was on the floor, the unit, whatever unit I was on, that computer device would default to that floor. So if we're on medical floor, we see patient listed here by location, status, name, etc. So this is your unit patients that will default as soon as you log into Quadramed and you're on this main desktop. So if you ever get lost in Quadramed, because it can be large and feel unintuitive, you can always click on this big house, big picture. Next to this big house, we have our patient search option. And it does just that. You can choose to search patients by this patient search option. If you click on it, it'll open up this option here, which is a drop down, and it will give you different kind of filters that you are able to search patients. So if you wanted to search by unit default, again, you could click on that. If you wanted to search by just active inpatients observation or discharged inpatients, you could go through and choose your options here. You can search in this field here by the 9 number, which is the medical record number, the 8 number with a V in front of it, and that is going to be the visit number. Or you can do their last name, comma, first name. And if it's a John Smith or a Heather Smith, we advise against that because that can render quite a few results, as you can imagine. So patient search, you are welcome to search by this patient search up here, or you can, once you're on this big house here, this main desktop, you can search, you can simply choose to click on your patients here. Now, as we go over these a little bit, these are just some buttons and some icons here to help you. So this intranet will take you to MHSC's intranet. MIDAS is for occurrence reports. You're welcome to use this calculator. Current location check-in, that's for when you have a patient that is an inpatient and they're going to go down to surgery. So when they go down to surgery, the surgical department will check them in. And then once they come back to their bed and medical floor, of course, they're going to be in that bed. So if they're staying in a room on the floor, 204, that is where they're going to stay for the inpatient stay. However, when they leave to go do ancillary and or have a surgery, this is why this current location check-in is important. This whiteboard is it's not to run on these smaller devices for individual patient care. It's going to be on the floors to show diet orders, any new stat orders, etc. And that is in the doc box and on the medical floor. Some other websites you can access here by this icon, and DC reversal. These other ones here you're not going to really have any use for. However, if you are going to go on the floor and you would be using those things, the nurses will work with you on those. Okay, so I'm going to go ahead and go to a patient search here. And I'm going to hit a dash because in Quadramed, a dash opens up everything. So it'll open up every patient in the system. You would not do that in the live environment. However, I am in the demonstration environment, so I can do it in this environment. And I'm just going to simply click on a patient here. So I'm going to click on Lab Ebony. Double click here. It's going to warn me that the recording starts now. I'm going to say OK. Now we're at a much more fulfilled screen, and as you can see, we still have this big house, big picture up here if we want to click on that. However, we also have this patient name listed, and with this patient's name, we have little house. So big house, big picture, little house, patient level. If you scroll over these are going to be your patient identifiers, including their location, their age, telephone, primary, just those patient identifiers to double check that this is your patient. You're also going to have your medical record number and your visit ID number. This cautions triangle here is a way for you to get a quick visual of the allergies or any kind of adverse event reactions if they're documented in the patient's chart. If you don't see this up here, that means that those items have not been documented in the chart. Also, as we go to this first place, we see this inbox. So at this patient, we can see that we have some criticals, abnormals, some stat orders, and we have some miscellaneous orders here. And these are built differently per ancillary department. So I could choose to click on these 5 laboratory critical orders here, and I could see those in my inbox. And notice you can't really see much here. So you're going to want to click on these by just simply double clicking. That's going to take you into that whole lab result for those critical abnormals for lab. And then you can choose to final accept down here, and that'll clear it out of your inbox. Same thing with stat orders. Again, you don't see much here. So if you're going to choose to click on any of these items to review them, you're going to double click here, open that up to see what that order is, and then you can accept final review. We say this because a lot of times there's comments and in the orders, and the doctors may put something in the comments, and if you miss it and you sign it, you're responsible for it. And the only way you're going to see it is by opening up these orders to sign them. And notice that clears them out. Again, here, if I choose to click on number 27, which is the total of all, this is going to show all these orders that are for this patient, and I would go into these orders and select and sign. So let's click on this one for medication. Just going to click on this. I can't see the whole thing, so I'm going to double click here. And then as you can see, we have comments. We have all these different items here that are providing us that information. So if I'm going to sign that order or accept that order as I'm going to do it, I want to make sure I know what that order says. Okay, to close this, I'm just going to click this X here to close the inbox. And that was our first tab. Next tab over is our document tab. You won't be using a lot of this stuff unless you need to do an event time correction. And that's what you can work on the floor with your nurse if you needed to change a time after you've completed documentation. You can do an event time correction. Let's say you accidentally did it at 9 o'clock when you document it, but you really did the event at 8. That you could use an event time correction here. This is this option. Med titration. This is for patients that are on a drip or anything that is being titrated. So as you titrate a medication, you're going to document this here, and you're going to see how this titrated medication flows on this side. So as you titrate the medication, you're going to put the times in. So if I were to choose to titrate something right now, which in Quadramed you can do it now, it's going to open up all this information here, and I'm going to put in these vital signs. So if I put 120, and then I'm just simply typing in these vital signs as this prompt down here is telling me so. I'm going to put just a few things in here. Then as we go through this, it's going to, once we're done, we are going to see on this other side, this medication ICG over here, what this titration looks like. So I went ahead and documented some things here real quick. So don't worry if you didn't catch those because we haven't talked about documentation. I hit accept. And then we can see this over here. So what I just documented here is now going to start to show. So imagine this as a patient who's critically ill and or constant titrating of medications on a drip. This is where you can see those here. And that's your med titration tab. Your IVAR and your IMAR are going to be where you scan your medications and give your medications. So you will be learning these a lot more on the floor, and we do the BCMA scanning. So you will learn that as you are on the floor. This overview tab is space sheets essentially. So if there's been information such as nicknames, preferred nicknames, or pharmacy information, religious information, you can sift through these space sheets to find that information versus digging through the chart. And again, these are, this information is charted on admission and history. So if you don't see anything here, it hasn't been quite documented yet. Order display, another tab. Of course, this just gives you your orders. It is only the active orders. So if you are looking for something and you don't see it here, hit this expand button here, and that'll bring in all the expired orders as well. If you want to see those and to look at more in depth into those orders, you simply just click on them. Growth charts are sometimes used, sometimes not. That's per your level of care and, of course, patient. 24-hour chart check. This is all the active orders. And then we can check those orders against chart review. So if we want to see if this last aspirin was given on time before we're going to leave our shift, we can go into our chart review and look for that documentation. Chart review houses everything that's been documented on the patient and or is ordered. Wound ICG. This will only populate if you have a patient with an ulcer or some kind of burn or laceration. It will stage it over time as you document it, so it shows that progression. Behavioral health, this is where our behavioral health techs work on the documentation for our behavioral health patients. Okay, so these were tabs we've sifted through, but you're going to be spending the majority of your time over here under patient shortcuts under this little guy. Chart review again, this is where you're going to find information if it's documented. There's nothing you can do besides look at information, and it's filed away and based on category. If it's grayed out, there's nothing in there, so there's no documentation. A quick way to look at something in chart review, you could type in it by procedure. So if we look at one of all of these events here, we know that we have a medication titration flow sheet. And as you here can see, what I did, I'll go back real quick. What I did is I clicked on all events. All events, that's what you're going to get, everything that's documented on this patient. But let's say I want to go to a specific event. So I'm going to choose to click on procedure down here. I'm going to type in titration dash, because again, that is a wild card in our system. So what our system is going to be looking for is whatever is between these dashes. So I want to pull in any procedure that was a titration. So I put dash, titration dash, and then we can go and pull in anything that has that word in that heading or the title of the note. So I double click here. It's going to take me into that titration that we just did, that medication titration. Also, in Quadramed, everything, even though all the information looks to be up here, it's the transaction line down here that's telling you or asking you what to do. So always pay attention to this transaction line down here. And notice we can trend, we can look at different views of this information. So feel free to use those buttons as well. Also, you can print here. To go back, you simply hit back until you get back to where it is that you started. And we started here. So that is Quadramed in a nutshell. Remember your ability to search via procedure, and also the way you can trend things, especially specific to lab, that sort of thing. That option's there. Please use that trending. Skipping down here, also real quick, this vital signs trend. This is essentially that as well. In this orthostatic, if the vital signs are taken on this patient, you're going to see this trend over time, regression. This work list here, we'll go here next. Work list is basically everything scheduled for the patient that the nursing staff is to do. So as we can see, we have a lot of status of scheduled here. And this is kind of the work list that nurses will work off to make sure that they're getting their documentation done and their orders done. So you won't do the medications or the IVs on this work list. However, you will do your rounding, any kind of documentation that's ordered, otherwise I's and O's, etc. So if we wanted to look at doing a documentation piece here, we would look at the time. And let's go ahead and do, let's see, we'll do an I&O here at 12 o'clock. So I'm going to double click on that. And then it's going to open this order for me first, and I can choose to document, cancel, or reschedule. Now, if the patient's sleeping and you have an order due, don't cancel it, because that kind of, it looks really bad in an audit trail. And we hope that you're not canceling an order, specifically if it was given to you by a physician. You can go ahead and reschedule that until the patient wakes up. So let's go ahead and do a reschedule real quick. And here we have a reschedule. The patient is asleep, so I'm going to choose that option. And again, I know that because down here my prompt's telling me so. I'm going to hit enter, or I could have hit OK. And then it says enter reschedule time. Now for training purpose, I'm going to put now. When it asks for the time, it's simply asking for that. If it's asking for the date and time, you have to do the date and time. So I'm going to do the time of now and enter. And then it wants me to accept the reschedule. In Quadramed, if you don't get to an accept button after you place an order or you do documentation, you're going to lose it. So you can hit OK, enter any other button you want 10 million times. If you don't get to your accept button, it never happened. So you must get to that accept button. So now we rescheduled it for 12:35. So we're going to go see that INO right here. So now we can just double click on it. And now we're going to choose to document it. And we're going to do it right now. And then I would go in and do my INO. Again, look at your transaction. Even though everything's up here, it's asking to select the field to edit. So let's go ahead and do oral intake. Once I clicked on oral intake number 1, it's going to take me into the documentation of that. And I have to choose D to document oral intake. And it's in mils, so all I have to put is 10. Now, if I only knew what they ate in liters, let's say they had 1 liter of fluid, I would put L. Oh, maybe it's not going to work here. Put it in mils. So if we're going to put, again, like we said, we're going to put 10 ml, enter, it pulls in that mils for us, and then we can say broth, and then we have 10 mils type of broth. We want to, if you get to this place where it says mark, or you think you're done with that documentation, you're going to hit OK to the next one, and OK one more time, and then it takes you back out to this, the rest of the INO that you can document here. But I hit OK. I'm going to hit OK one more time, and then I'm going to hit accept because all I wanted to document was that intake. I could choose partial. Let's say that you have been interrupted or you need to go do some patient care. You don't want to leave your computer screen up. You can choose to accept as partial. It will stay on your work list as a partial here. If you were to have completed that note, it would go off of your work list because that is now done. So partial is where you can come back to that note when you go back and you're able to finish that. So remember that partial option. Okay, now going beyond work list, let's go to unscheduled documentation here. Unscheduled documentation is all these items that different departments can do based on an RN license. You don't need an order to do these. You have your vitals, I's and O's, flow sheets. So if you've done some extra care or you want to do a more in-depth detailed of care, you can go ahead and grab your unscheduled documentation here. So let me grab the vitals, height and weight, and let's do admission, height, weight. And I simply just double click. And again, I'm looking at my prompt. It says the date and time for this unscheduled. I'm going to put now and OK. Now these items here, if you see bolded items, bolded fields, those are required. So if you can't get to an accept button or you can't complete your note, you're probably missing a required field. It says enter height in centimeters, but I don't know centimeters. And here's where I was talking about when we were just looking at the liters versus milliliters. So if you don't know centimeters, but I do know that this person is 6 foot tall, I'm going to put 6 foot and enter. And what that will do for me is it will convert, the system will convert to centimeters and inches. So if you don't know the conversion, especially for heights and weights, make sure that you are labeling that, you know, if it's 5'4" or that kind of thing. So the system will do the conversion for you. Again, weight's the same thing. So they're 175 lbs, but this is asking for weight in kigs. So I'm going to choose lbs and enter. And then again, that converted to kigs for me. So the second field, as we're going through this documentation, is taking me to the next field. So I'm going to put, we did a standing scale type. So my options of method are patient stated, unable to attain, etc., and then the scale type. So I'm just going to say they were this weight on a standing. This is where I measured them on the standing scale. And then as you can see, the calculations of the BMI, ideal body weight, that sort of thing, populated with those fields. Again, we're to this transaction that doesn't really prompt us to do anything, and we don't want to use any of those buttons. So we're going to hit OK until we get to our accept or accept as partial. Once you do that, the documentation is off of the work list, or you've completed that unscheduled documentation. Okay, another item we can go over real quick, and again, you're going to get a lot more of this when you're on the floor. This general patient education is that. So you're going to, once you choose to do some general patient education, you're going to choose this education topic. You can search education via CRAMES, and it can be on your medications or disease type, and this allows you to document that meditation with, or excuse me, that education with the patient response and how you did it, etc. So that is general patient education. If we look over here, we're starting to pile up the different places we've been. So when you're new at Quadramed, be careful with that. And you can simply close these items by clicking Xing on them. And if you have something open, like right now, if I choose to close this, it's going to say you may have some potential work in progress. Would you like to still close? So that gives you the opportunity to go see if you have something open that you're documenting. But I'm going to hit yes here. And then that closes all those fields for me. And even when we initially started, before we got into this chart, there's an X here. That's when we search the patient, and I can close that there. Patient schedule is something you'll learn more about when you're here. And that is if you have to cancel something because of a duplicate or you need to correct your documentation, you're going to go through patient schedule. You're going to look for the date and time you did the note, and then you're going to click on the note that has the abbreviated title. So as we can see here, aspirin. This was a new order for aspirin, and so what I could do is choose to document from patient schedule, which you won't do unless you're trying to check in a patient to their room, and you'll learn that when you get on the floor. Or you can cancel here, and if there was a document or correct option, supplement or correct, that's when you would go in and complete that note there. So that is your patient schedule. It's not real pretty, and it won't make a lot of sense until you start working with patients. And finally, just so we make sure you remember this, this is your interactive care grid. So if this had numerous lab values, vital signs, I's and O's, this is where you can see how that information scales over time. So, and you can go back in the documentation to these different dates, and it scales by 12 hours. So on this, you're going to see green, which is good. So we can see that there's 2 items in here that were normal. And with your chemistry, hematology, any kind of lab, that's important. Here's a triangle, and that's going to be abnormal. So this is abnormal is going to be underlined and bolded. And if you wanted to see what that one of 2 items is, you just simply double click here, and this will take you into that bolded underlined item that is abnormal, and then you can see that result there. And all I did was just click on those levels, and it brought me in there. If you see a red exclamation, which I don't on this one, red exclamation means critical abnormal, kind of like we saw here. So a red exclamation here, oh, we got one right here. So if we click on this, this will take us into what is critical. And again, we can go in here and we can see that red, the critical lab value here. So this interactive care grid is a really neat tool to see progression over time of the items that are listed on the left here. Now let's close out of this patient's chart, and I can simply do so by hitting the X. We're back to our main desktop. We've gone over how to find patient information, how to find face sheets, where miscellaneous patient information, where to find those, how to search patients, how to document, especially using the unscheduled and the work list. Remembering the accept button when you do document. Also, cancel versus reschedule. Consider that for an audit trail, and canceling an order is something you need permission to do. Also, we've looked at how to search for patients, and I think that the rest of this will make a lot more sense when you are able to work on the floor, especially with medication administration portion. So if you ever have any questions, please feel free to reach out to informatics. Also, if you're ever concerned that you're not who you are when you log in, this is where you should see your name and make sure that is you. If you have any questions about or having troubles logging in, reach out to informatics or IT because you may need a password change, or we might be something that we need or they need to troubleshoot. So last but not least, always log off properly. Before we do that, this mail is not your email, just an FYI. So unless you have a patient that has some kind of maybe wound or ulcer or any kind of alert in the system that we turn this red, feel free to take a look. That's going to be related to patient information. And always log off properly in Quadramed using that log off key, because if you don't, your session will get hung up and locked. And in order to cancel that session, we have to completely reboot any and all computers that you are on to do so. All right, thank you, and I hope that was helpful.